D. B. Blank is the process in which individual units or different organizations make independent decisions about the next appropriate action. A freelancing B. So Command C. Unified Command D. Effort duplication. A. An individual span of control, A should be self-assigned and dependent on the incident size. B is the degree of responsibility assigned by a higher authority. C represents the number of personnel who report to him or her. D limits his or her autonomy to delegate tasks to another person. C. Command functions include all of the following: EXCEPTD, A triage officer. B safety officer. C liaison officer. D public information officer. A. Which of the following is not a responsibility of the incident commander? A. Assessing the entire incident scene. B. Developing a plan to manage the incident. C. Establishing strategic objectives and priorities. D. Authorizing medical treatment interventions. D. 10. During a small-scale incident, the incident commander, A, will likely not respond to the scene. B may perform all the command functions. C primarily assumes the role of safety officer. D delegates all authority to the senior paramedic. B. B. C. A. The transfer of incident command should occur, A, when the most experienced paramedic arrives. B, over the radio so all involved personnel can hear. C, at least every hour throughout the entire incident. D, face-to-face, if possible, and in an orderly manner. D. A. If responders at a major incident require additional medical equipment and supplies, they should notify the A Logistics Section. B Planning Section. C Operations Section. D Liaison Officer. A. B. C. Occlusive dressings and large-bore IV catheters for thoracic decompression are supplies used to address blank issues at multiple casualty incident. A disability. B breathing. C circulation. D airway control. B. 20. The blank has the authority and responsibility to stop an emergency operation if he or she believes a rescuer is in danger. A logistics chief. B rescue officer. C triage officer. D safety officer. D. If an incident is such that it warrants evacuation of people, the incident commander would most likely request that the blank disseminate that information as well as evacuation directions. A safety officer. B liaison officer. C operations chief. D public information officer. D. A. C. 2. Most important underlying principles of National Incident Management System are A. Compliance and funding. B. Flexibility and standardization. C. Personnel training and certification. D. Interoperability and public awareness. B. B. When sizing up the scene of a multiple casualty incident, the least of your initial concerns should be A. The nature of the incident. B. Requesting additional help. C. How you will react initially. D. Why the incident occurred. D. A. C. Initial command of an incident should be assumed by the A police chief or his or her designee. B. First paramedic to arrive at the scene. C. Most experienced public safety official. D. Highest ranking individual at the scene. C. 30. When functioning at the scene of a major incident, communication should A. Incorporate signals for privacy purposes. B. Be face-to-face to minimize radio traffic. C. Involve the use of codes to limit airtime. D. Occur via radio to keep everyone updated. B. D. The primary duty of the triage officer is to A. Quickly remove the deceased from the triage area. B. Ensure that every patient receives a primary assessment. C. Immediately identify the most critically injured patients. D. Evacuate patients to the most appropriate treatment area. B. As soon as the treatment officer receives patients from the triage section, he or she should A. Perform secondary triage and begin treatment. B. Immediately tend to the most critically injured. C. Attain the names and addresses of each patient. D. Make radio contact with the transportation officer. A. The primary function of the treatment section is to A. Expediently move patients to the transportation area. B. Rapidly assess each patient to determine injury severity. C. Separate and treat patients based on their triage category. D. Treat each patient in the order in which he or she presents. C. 35. Communicating with area hospitals to determine their capabilities and resources is a responsibility of the A. Treatment officer. B. Individual paramedic. C. Chief medical officer. D. Transportation officer. D. The staging supervisor is responsible for A. Tracking the number of vehicles transporting patients. B. Supervising all responders who are providing treatment. C. Requesting additional medical supplies as they are needed. D. Coordinating with all incoming and outgoing ambulances. D. B. B. A. C. C. In contrast to primary triage, secondary triage requires a more rapid assessment. B. Is performed in the treatment area. C. Is typically performed by a physician. D. Involves initial placement of triage tags. B. D. Which of the following injuries or conditions should be assigned the highest triage priority? A. Full thickness burns. B. Respiratory distress. C. Cardiopulmonary arrest. D. Multiple long bone fractures. B. 45. Triage tags that have tear-off receipts are most useful to the A. Triage supervisor. B. Treatment supervisor. C. Incident commander. D. Transportation supervisor. D. A. According to the STAR triage system, a non-rebreathing patient should be triaged as immediate if A. He or she is in need of immediate intubation. B. The airway is completely blocked by swelling. C. A manual airway maneuver restores breathing. D. He or she does not respond to two rescue breaths. C. According to the STAR triage system, if a patient has a strong radial pulse, you should A. Place him or her in the delayed category. B. Control bleeding and assess mental status. C. Assess his or her ability to follow commands. D. Determine whether the pulse rate is slow or fast. B. B. 50. According to the Jumpstart triage system, if an infant or child is not breathing, you should deliver 5 rescue breaths. B. Manually open the patient's airway. C. Categorize the patient as expectant. D. Immediately assess for a pulse. D. A. C. C. B. A. D. D.